Hi, I'm Marianne Clyde, and today I'm talking with Dr. Diana Chalmeta, who's a pediatrician, and we're going to talk about kids with special needs. Hi, Diana. Thanks for coming.
My pleasure.
So let's just get started and talk about, what do you suggest? A parent is observing some behaviors in their child that they might not think are normal or typical of a child in that age range. What's your suggestion, the very first thing they should do when they suspect?
Well, if a parent is anxious, their natural instinct is, of course, to turn to the internet, and they will probably find some things there that may or may not help. And then after that, they should always come to their pediatrician or primary care physician so that they could act as a filter to help them kind of look at that information and decide what's important and what's true and what's not, and they can provide reassurance if it's appropriate, or they can suggest other methods of investigation to see what if there truly is a problem. They should not rely on their pediatrician to know what it, or family doctor to know right away what's wrong with their child. It will probably be a process in terms of determining what's happening, and we have some screening tools that we use in the office to help us, but we can't tell just by looking at your child if they have a problem or not. There's an interesting study that was done where related to autism spectrum disorder, where they put some children in a room and had some interactions with their parents, and they had specialists who only worked with children with autism looking through the window to see if they could determine which kids were the normal children and which kids were the ones that had autism spectrum disorder. And they had 10 to 20 minutes to observe without interacting with the child themselves. And 40% of the time they misdiagnose a child as whether they were normal or not. Okay. So, you know, having regular visits with your pediatrician, which typically last 10 to 20 minutes, they're not going to be able to necessarily tell you or recognize that your child is normal or not.
But if you suspect, you'll use some of these assessment tools.
Right, so that's why we rely so much on the parent. The parent sees the child every day and it spends a lot of time with the child and can see that their child may or may not be different from other children around them. And so it's a very important part of the process for the parent to approach their pediatrician and say, I've seen these things and I'm worried, because then that will bring the pediatrician's attention to the child and the specific issues that the parent is seeing, and be able to then start the screening process in a more in-depth way that would help actually sort out the problem. And you know, we have lots of tools that we use for kids with Asperger's or autism spectrum disorders, which is what it's more called now. Right. Then we use the MChat in the young children to start, and with older children we might use neuropsych testing, which would be go directly to neuropsych testing, whereas with children with ADHD we may start with a questionnaire such as the Connors form or the Vanderbilt screening tool, which help us to see whether a child's behavior is truly ADHD or if it's something else that's masquerading as ADHD, such as depression or behavior disorder or a learning disorder.
Right, so that's, you help a parent differentiate what that is, which is really wonderful. And then when would you refer to a neurologist or a psychologist or a psychiatrist? When would you make those kind of referrals?
Well, you know, it depends on the individual, as with everything. Some children we can handle very easily in our office because their problems are very manageable. We have some tools in our armamentarium that we can use to help parents. We have but then we do use the specialists, particularly for autism spectrum disorders, quite a bit. With ADHD, that's something that more often we can handle on our own in our office. But with the autism spectrum disorders, it is a team approach. It has to be a lot of people involved in terms of specialists. Right. You know, we need our physical therapists, we need our speech therapists, we need our occupational therapists, we need behavior therapists. And in the classroom, you know, we have a lot of resources as well for helping children to be around normal peers and to learn to behave socially correctly, or not socially correctly, I guess what I mean is appropriately, so that they're welcomed by their peers.
Okay. More acceptably, yeah.
More acceptably.
I know what you mean.
And then for children with ADHD, yes, we have a lot of recommendations that we can make both in the classroom and at home, as well as in our office. It's rare for ADHD to need to be referred out, but sometimes children with ADHD, besides having ADHD, have behavior problems and other comorbidities. And when we identify those, then we might refer for help with dealing with those sides of that.
So what then is your philosophy about medicating children, or medicating and in conjunction with nutrition? I mean, what's your philosophy about that?
Well,
I know
healthy
that's
living
a general question.
It's a very general question, but it's a wonderful question. And of course, we could talk about that for a long time, but I'll try to focus on some of the important details about that. First of all, health and nutrition are so important to everybody's functioning. If you're not getting enough sleep, you're certainly not going to function well. You're not going to interact with people around you very well. If you're not getting good nutrition, same thing. You're not going to function well. You're not going to feel good. You might be tired, and that'll affect your interactions and the way you react to things. You'll have a lower threshold for being frustrated. And so diet, nutrition, good sleep, all those things are important and a big part of the focus of the pediatrician or primary care physician to make sure that there's nothing that is exacerbating a child's symptoms. I try very hard to look at the literature all the time to see if there are any specific nutritional therapies that could help, because a lot of parents have questions about that. And unfortunately, there's no great answer there, no perfect medication that's over the counter that really helps. But there are some things that do make things better to some extent. And we can certainly discuss those and see if they're right for an individual child. As far as medications go, there are more benefit to medications in children with ADHD than in children with autism, depending on the severity of the autistic spectrum. People who are mild in the spectrum probably don't need to be medicated, but children who are self-harming or have really aggressive behaviors or may benefit from medication quite a bit. Whereas with ADHD, it's more clear-cut that there can be a lot of benefit from medication. Having said that, we always try to start out without medicating if we can, and we'll look at the child and see how they're responding to our interventions in the classroom, our physical and speech therapies. And then if those things aren't working, then we'll start to recommend medications if it's appropriate and if they've been screened and found to really have the diagnosis that we think that they have. It's important to know that we're treating what we think we're treating. Right.
I think a lot of parents would be really happy to hear what you just said about your first go-to is not necessarily medication. You do behavioral things, you do nutritional things, and then you decide what's the severity, what's the outcome. Of course, the main thing is to keep the children safe, which is, you said, if they're self-harming, of course, medication actually helps calm that down and so forth.
And medicine is an adjunct to all those things. I mean, that has to be strong and important and the focus from the get-go. Medicine can help, but it's not a substitute for healthy living and good parenting and all the things that come with being a person.
What do you think your main concern is, or pitfall, I guess, might be a way to say that parents might fall into that you can help keep them from doing?
Well, children are different, and everybody's child is unique, and so you can't compare your child to other people's children. You just can't. And even children with autism and ADHD are unique from one another. So this medicine working for your friend's child doesn't mean that it's going to work for your child, or this intervention that worked for your friend's child may not work for your child, and your child may be normal because just because your friend's children sit at the table and are very well behaved and never get up and never talk back doesn't mean that there's that there's something wrong with your child because they tend to fidget more. I found it really interesting. One time I had a pair of kids who, one was a boy and one was a girl. They were twins, and we were concerned that perhaps they had ADHD, and the Connors forms grade children not just on age, but also on gender. So, you know, certain things are more normal for boys than girls, and certain things are more normal for young children than older children. Right. So, for example, you know, a young child, it's normal for them to be very explorative and not be able to sit for very long, whereas an older child should be able to sit for half an hour or an hour, you know, without getting out of their chair. So I was grading the girls' form accidentally on the boy side of the form, and everything came out completely normal. And then I noticed my mistake, and I flipped the page over and graded her on the girls' form, and she was off the charts on everything. Okay. So, you know, you can't even compare girls and boys. You really have to realize that normal is something different for everybody.
So that's a really important thing, is because you had also said as parents, our first instinct is also first go to the internet, find out what you can find out, or look at the other kids, see what the other kids are doing. But what I hear you saying is that your advice is that's okay for the moment, but come to the pediatrician that's been seeing that child for however long it's been if you have a question, because you're the one that has been watching with the parent the differences in the child and so forth. So face-to-face meeting with a pediatrician can be much more helpful than surfing the net and finding out generalities. Is that correct?
Absolutely. Then we can apply the appropriate screening tools and see if your child really falls into an area of concern, if there really are red flags, and then we can make recommendations based on that, whether it be that we start to change some things in the home environment, whether it be referral to another specialist. Those kinds of things can be addressed, you know, as needed, or reassurance and just monitoring.
Yeah. And you know, we could talk about, like you and I talked about before we were on camera, is that we could talk about any one of these things for an entire course in itself. But do you have any words of encouragement or advice for the first time parent who's afraid and kind of nervous about, oh my gosh, what do I do for my kid? What would your main advice be for them before we close up?
Well, my main advice is that you hear a lot that the earlier you diagnose things, the better the outcome. And that's true to some extent, but I think that the truth of the matter is that the earlier you intervene, the more quickly you might see results. I think that there will always be opportunities for progress and opportunities for getting your child to where they need to be. So even if you feel like you're coming into this process late, you still are going to find that you can change behaviors and make things better. And if you stay on top of your child, keep your follow-up appointments, you will see progress, and your child can achieve the goals that they want to achieve. And we can definitely work together to get you there. It might take longer if some behaviors are more ingrained because they've been going on for longer. Right. Everybody knows that if you can nip something in the bud earlier, you can make faster progress, but that doesn't mean you can't make progress and that you can't achieve the goals you're looking for.
Oh wow, that's really valuable advice. I appreciate that, because I noticed in some of our other videos, some of the parents had said, I wish I had caught it sooner. I knew we had to, early intervention. And so they were kind of discouraged that maybe they didn't diagnose their kid till they were 9 or 10 or even 12, you know. And so I love that advice. That's really encouraging and fill us with hope. So thank you so much for taking time to explain some of the basics to us. Really, really appreciate your being here.
Oh, thank you for having me. It was a pleasure.
And thank you. We want you to know that just take a deep breath and relax. Visit with your pediatrician and don't be afraid to ask questions. Thanks for joining us.